Hello, everyone. This is Sophia Silao, the Program Officer at the New York Health Foundation's Special Projects Fund, and welcome to our webinar entitled A Blueprint to Transform Mental Health and Substance Use Services in New York State. Now, before we begin, I invite everyone to drop your name and organization in the chat so we know who has joined us today. And today's session will be recorded and closed captioning is also provided. Okay, so New York is facing an unprecedented mental health and substance use crisis. In 2021, close to 3 million New Yorkers experienced a mental health issue, and about 13,000 New Yorkers die each year from opioid and alcohol-related causes. Treatment systems have historically been siloed, and thankfully, we're now seeing an increasing awareness of the need for a no wrong door approach and more integrated models of care. The Coalition for Behavioral Health and the New York Association of Alcoholism and Substance Abuse Providers are two leading membership organizations that provide advocacy, policy, training, and technical assistance to folks working on the front lines, working in the mental health and substance use disorder space. And as independent entities, they often found themselves in the same meetings and talking about overlapping issues. In 2022, they collaborated in a joint COVID-19 recovery and response initiative to support their members. And building off of the momentum of this effort, the two organizations decided to merge and form InUnity Alliance, an entity that represents more than 250 addiction, mental health, and social service agencies, and in turn, supports over 800,000 New Yorkers. So it's a merger that some have called quite transformative. And I'm joined today by three of their leaders, each with unique perspectives on the work at hand, and together they'll help realize the vision of InUnity Alliance. First is Amy Doran, a licensed clinical social worker who has worked in government, healthcare, and the social service sectors. And she most recently served as president and CEO of the Coalition for Behavioral Health and is now InUnity's Chief Operating Officer for Administration. John Coppola was Executive Director of the New York Association of Alcoholism and Substance Abuse Providers and has decades of experience working on addiction services and related issues in New York State and across the country. And he's now InUnity's Chief Operating Officer for Policy and Advocacy. And the third member of this triad is Ji-Hoon Kim, who is their new Chief Executive Officer. Ji-Hoon served as Deputy Secretary for Human Services and Mental Hygiene under Governor Hochul and has worked at the New York State Senate, the New York Attorney General's Office, and the New York State Office of Mental Health. Welcome, Amy, John, and Ji-Hoon. Before I begin, I also want to invite the audience to send us questions and comments in the chat, and I'll try my best to weave them into our discussion. So I'm going to first start by asking Amy and John to please help level set our discussion by providing some information about the genesis of InUnity Alliance and why your two organizations decided to merge.
Thank you so much, and really a pleasure to be here. Probably about 4 years ago, maybe a little more, both organizations began to talk about merger. John and I, our boards, our membership. And I think the two most significant reasons for moving ahead with the merger had to do with, number one, the need to amplify our voice. The coalition represented about 100 community-based providers, primarily in New York City, and mostly providing mental health care. ASAP, as John will tell you, had about 150 members, mostly providing addiction, substance use services throughout New York State. Number one, we wanted to amplify our voice in advocacy because the numbers, the people represented have significant impact. Also, we felt very strongly that addiction and mental health needed to be brought closer together and that there needed to be integration on all levels. We, representing the coalition level, wanted to march ahead with that. And certainly having penetration around the state from both groups of providers was very significant. John, I'll turn this to you.
So good morning, everybody. Really happy to be with you and appreciate this opportunity to talk to you about some really exciting developments, I think. As someone who worked primarily in the addiction field for many years, and then with the New York State Association of Alcoholism and Substance Abuse Providers, very frequently I would find myself working closely with mental health advocates and with advocates across a whole variety of different health and social service type groups and focused on issues that were very cross-cutting. And it became really apparent to me in working closely with the coalition and other groups that coming together to be more efficient in our work, to make better use of our resources, and to be more efficient as a voice for service providers and a voice for people who are concerned about mental health, people who are concerned about addiction, people who are concerned about the workforce that's serving people who have mental health and addiction problems, as well as a host of other social service type challenges. That it was really important for us to really step up and to try to create a voice and to create some momentum that would take, really help to take us in a good direction. So, looking at things like co-occurring disorders, workforce, and so many other issues, it was really, I think it was really the right idea at the right time.
Thank you, Amy and John. And so I wanted to actually ask Amy, if I understood this correctly last time we spoke, that New York is one of the few states in the country that does not have interconnected agencies. Is that correct?
That's correct. That's correct. We have separate organizations, separate state agencies, OASAS, that licenses substance use providers, and the Office of Mental Health licensing mental health providers.
Great. And so thank you for that, Amy. John, so you sort of touched on this, and I wanted to give you another opportunity to, sort of from your perspective, what is what's exciting about the potential that this new entity, Inunity Alliance, what does it offer to us as a community?
So I mean, as I think everybody who's here this morning would agree, these are extraordinarily interesting times. We live in a country where the word polarized is so much a part of so many different discussions. We live in a very diverse state. We have rural, urban, suburban. And as you just pointed out with Amy, that we have two separate state agencies dealing with addiction and mental health. We've got another one that deals with general health, and so many other state agencies focused on singular problems. And we know that the people who are coming in for services are people who have a host of challenges, not just one. And there are several societal challenges that have come up in recent years, as we have increasingly dealt with really sort of blatant racism, structural racism, and all of the problems and consequences of that one problem, and to say, how are we addressing some of the structural problems that keep us from making the kind of progress as a society that we need to make. But it's also in our service delivery system. As we're trying to help people, how is it possible that we have something called a health desert? How is it possible that we have inequity in health outcomes? And so as we began to talk about, sort of a more efficient use of our time and resources, and to try to develop strategies where we would be more effective, we sort of realized that we cannot do something like this without contemplating the degree to which we're part of some of those problems or we're part of solutions. And so it really forced us to, asking that question, really forced us to say, as part of our foundational values, we have to look at this whole issue of equity across many different dimensions, race being a very important one. But how have we, in health deserts, how do they happen? Where do they happen? And so again, to guide our development of a good team for Unity Alliance, but also to really drive our policy focus and the people that we're working with. So those are extraordinarily important. So on some level, taking on that magnitude of consideration and that kind of scope as we launch in Unity Alliance is extraordinarily exciting. And knowing that our agencies, we have 250 member organizations now, are really strongly supporting that vision and that kind of direction is I think it's really extraordinary. And I think Amy points out frequently, one of our foundation supporters talked about it being a seismic change. It's a seismic, and it feels that way. So it is very exciting.
Sophia, if I may,
Yes,
the other
please.
thing about the merger is we wanted to take advantage of a moment. It was a moment when, because of the pandemic, unprecedented numbers, as you mentioned in your opening remarks, unprecedented numbers of people were coming into the system, often for the first time, for help with an addiction problem and or a mental health problem, children on up. And so we really felt that the merging of the two organizations was optimizing a moment for change. And so that kind of, added to our thinking about the merger.
And, when you think about the number of folks that are, joining us today, who are from community-based organizations that are concerned about a variety of different issues, they belong to so many coalitions and statewide organizations and regional organizations. And our vision was really, as reflected in our name, in unity. How do we kind of pull together, how do we pull the richness of people concerned about specific issues, broader issues? How do we pull together and speak with one voice, and to bring the wealth of experience from all of those different places together in one place? So that's really exciting for us as well.
Yeah, and so I actually wanted to loop Ji-Hoon in as the new CEO and get his perspective on this. So Ji-Hoon, you are charged with building this new way of working together across different sectors, right? So you've over 15 years of experience working in government. And from your perspective, first question is, what do you think the state and local government has been doing right to respond to the issue?
Thank you, Sophia. And really, it's a pleasure to not only be the inaugural CEO of InUnity Alliance and what I call a very worthy experiment, right? But also to see all the amazing people that I've had the fortune of working with, dropping their names in the chat. And I really look forward to the ongoing collaboration, with InUnity Alliance and all of the strategic partnerships we want to build. And you're right. I spent the majority of my post-grad school professional career in state government. And I will tell you, it was the most rewarding experience, where I think I had multiple opportunities to touch upon different levels of government, as well as, even though it was a brief stint at the Office of Mental Health, before I returned to the governor's office. And there are many wonderful things happening. And to Amy's point, we're at this critical moment where you can't have a conversation with somebody in your personal professional life where, the overdose epidemic or lack of access to a social worker or a psychiatrist or some kind of mental health care doesn't come up. And I, in my role as deputy secretary, but even before that, would get asked a lot of times by friends, hey, my 12-year-old is told that, he has to wait 12 months to see a psychiatrist. Can you help? And then scrambling to figure out what kind of insurance they have and trying to problem solve with them. There are times when, even on a personal level, with the role that I played in government, it was embarrassing that I couldn't kind of kick the door open for people who were friends, family, to better access the life-saving care. that they needed at points where we could prevent more expensive intensive care later in their lives. And yes, I think with the governor in New York who is focused on both dueling crises, an overdose epidemic, and the lack of adequate access to affordable mental health care, and anyone that you talk to bringing up this topic, this merger comes at a critical time, and the state has done a lot to respond to the dual crises, but I would argue not enough. And, I think I'm somebody who can speak to that very directly because I was involved in a lot of the projects and initiatives that Governor Hochul launched or invested in since she took office. And there are a few examples, especially on the integrated care side, because I can talk a lot about everything, but I think we're talking about what I call the experiment of integrating two advocacy organizations, right? And there has been progress on integrated licensure. While it's true there are distinct state agencies that oversee and license providers in addiction and mental health, which there is both good and bad, that comes from the fact that there are distinct agencies, which I can get into a little more. But in addition to progress on integrated licensing, the state has been focused, as the federal government, on the expansion of CCBHCs, right? Where one of the components is a higher rate, but two, it is much more of an open door than the kind of dual licensing structure of the state oversight agencies. And then on a crisis level, the state has really doubled down on launching crisis stabilization centers, right? That also have this perspective that you may be in crisis for substance use, or you may be in crisis for a mental illness. But at whatever time of day, if you are in crisis and you cannot get access to other kind of traditional or historical forms of assistance, the state is expanding these crisis stabilization centers, which I equate to urgent care clinics, right? On the public health side, on the medical side, and no one disputes that if you cannot get your primary care doctor to give you an appointment, within 2 weeks and you have an urgent need, that you should be able to walk in to an accessible clinic without any stigma or any disparities and get the help that you need, especially if it could prevent more serious issues. And I think those are a few examples of what is working well. And I think I just touched upon it, but I think if I can, let me stop there, Sophia, because
Yeah.
I
Yeah,
know
I
you
actually
have
wanted
multiple parts of this
to
question.
flip my question around and to ask you, now that you're on the other side, what would you like to see done differently to the approach, and what are some of the recommendations or thoughts that you had for your
I appreciate that. I think
colleagues?
the elephant in the room is a question that Amy was asked and touched upon, which is the fact that there are distinct regulatory structures in New York State, where that is not necessarily the case in other states, nor is it the case in the biggest municipality in New York State, New York City, right? So, I have many thoughts on that. When I first was a senior policy advisor for human services and mental hygiene under the prior administration, that was the second attempt, I believe, that the state made to try to merge OASIS and OMH. And, I think I personally learned a lot about just the bureaucracy and also the politics that kind of overshadowed the core reason that conversation or effort was underway, right? And I think where I am today is recognize that there's immense value in having agencies that focus on very specific topics, especially when you're talking about very stigmatized populations, right? I think I would hope that in modern times we wouldn't be talking about challenges to site OTPs, methadone clinics, or other life-saving treatment, but we're in an era where that's still the case. There's tremendous stigma around the people who just need care, right? Whether it's for a mental illness or for an addiction. And so to that degree, the good in the structure in the New York State level is that you have leaders like Dr. Sullivan and Dr. Cunningham who can really focus their energy on such important, critical, life-saving issues for so many New Yorkers. That's the good. I think the place where it's bad is I spent 15 plus years in government. I mean, when I had a friend recently this morning say, welcome back from the dark side, right? And listen, I don't look at it as the dark side. I think there's tremendous good that government does. I think I did a lot of positive work in government. And I think that is where, when you think about government, most people think bureaucracy, right? We get bogged down with bureaucracy and you kind of get boxed in. That is a significant challenge. I think, whether it's a resource issue or a prioritization issue, people do kind of retreat to their corners. And, I don't want to just make it about the two behavioral health agencies. I think significant funding for all of these services comes through the Department of Health and Medicaid. So, that's another critical element when we're talking integrated care and better integrated care, is not just looking at it from this perspective, which I think is a distraction, that why does New York State have two separate agencies? I think it's really talking about, we have payer systems and regulatory systems that are distinct, and there's both good and bad from that. But how then from that, the questions we should ask is not why can't we merge the agencies? The questions are, what is working within the current system? What is not working within the current system? And what do we do to fix what is not working? And instead we get bogged down with this kind of, this narrative, which John said, polarization, where people retreat to their corners. I know that's a little ironic as we're talking about In Unity Alliance and our experiment merging advocacy organizations, but I would argue that combining, and maybe John and Amy will look at me like, are you crazy, Jihoon? Like, it's been really difficult doing this. But I would argue that, merging two advocacy organizations that have really worked well together historically is a much easier proposition than merging bureaucratic agencies, right? So I think there's a lot of work, especially with the leaders that Governor Hochul has in place at the state level, who I've personally witnessed working really well together, whether it's regulations for hospitals regarding people with psychiatric disorders and or substance use disorders, and the continuum of care, making sure they have adequate access to appointments after their discharge from inpatient, or even talk about network adequacy as it relates to behavioral health care. I've seen firsthand how much good you can do when the brightest and most passionate put their heads together and say, let's get this done. And not only on top of that, I know how much the governor is committed to making sure that we break down silos. And when the executive of New York State is saying to her commissioners, I expect all of you to be serving New Yorkers in an integrated way, trust me, it happens. And I've seen it. So I think there's a lot of work we can do from my perspective, from my end, knowing what I do know about the processes in government to really help foster that conversation, because sometimes government does need an extra push from people outside government.
Absolutely. And that's a good segue to another question that I wanted to pose. And I'm going to invite John and Amy to respond to this as well, and sort of to bring it back down to the grassroots level, right? And so I was curious to hear what In Unity has done, and what you will continue to do moving forward to center the voices of individuals, the families affected by these issues. I'm thinking specifically about, communities that have historically been underserved, such as, LGBTQ plus youth, older adults, individuals living in rural communities with, tremendous provider shortages. Like, what have you guys done, and what will you envision doing moving forward through this new entity?
So I just want to start, John, if I may, just talking about our two projects that we've embraced. One is a leadership institute to ensure more diversity on the executive level of our agencies and on our boards, and happily have received funding from OMH and OASIS and the Mother Cabrini Health Foundation. And we're excited about that because it has the potential of really changing our sector, changing some of the practices, and really ensuring diversity. And the other is an integration project, which we partner with New York State Council for Community Behavioral Health Care, trying to help further efforts to integrate on the ground. And we'll be coming out with a paper that looks at some of the regulatory and other barriers that are not allowing full integration on the ground. So those are two projects, and I think we believe that Inunity should embrace projects that have impact on the sector, and that we're in a really good position to do that. So there'll be more to come. And I think we have a very big vision. And John, I'm going to turn this to you, since at the center of the vision is policy and a policy center. So I'll kick this to you, John.
Yeah, I think one of the things that is really imperative is, as Inunity Alliance begins to forge a path forward, what is the infrastructure that we're creating? And the infrastructure, Amy just mentioned, policy has always been one of the primary areas of focus for both the coalition and ASAP. And as Inunity Alliance, we didn't want to just replicate what each of us was doing. We wanted to, step it up a level, so that policy is not just about advocating for more funding for service providers. That's really important, and we'll continue to do that. It's not just about trying to provide, or not trying, but actually providing input to state agencies about their regulatory infrastructure and how it should be changed to become more efficient and to better address the needs of people in communities. That's also hardwired into our infrastructure. Prevention, a part of the work that is very frequently an afterthought in many advocacy groups. We didn't just say, yeah, you're going to be part, we say you're going to be a major part of our discussion is going to be our focus on prevention, which has long been neglected. Diversity, equity, and inclusion. Again, Deirdre Rice-Reese leading the way for us in terms of chairing that committee along with others. That has to be a priority, and we said it's not just a committee of the membership; it's going to be a committee of the corporation as well. So in building, we made sure that the building blocks were there. Harm reduction along a sort of debated area of our work as a field. To what extent is that going to be? So we have a downstate representative, an upstate representative chairing a harm reduction committee. So all of the areas that were important to the members of the coalition and to ASAP, we said, no, that's got to be hardwired into the infrastructure for Inunity Alliance. So the policy center that we envision as being this kind of major force, I think, for behavioral health, for addiction and mental health. When and Jihoon has a huge responsibility here of sort of bringing that together. We envision that as a place where the interests of the broad spectrum of people concerned about mental health and addiction services, that those interests will be adequately addressed. And we have the infrastructure in place to provide the support to ensure the success of that policy center. I'm really excited about that.
I just,
John,
one
I'm
more
sorry.
thing, adding
Yeah.
to John, is a training center. We already provide workforce training. Workforce, as with all other coalitions, is our #1 concern, because without a workforce, we go nowhere, and we're not able to serve all of the New Yorkers that need help.
Yeah, and
So-
our work with Open Minds, to make sure
Yeah.
that the finance people and the business people who are trying to keep the lights on in all of our organizations, the partnership that we have with Open Minds, will give us access to some of the best consultants and resources, that exist in the country. So we're really excited about that.
Yeah.
And if I could add,
Training-
if
Go
I could
ahead,
add,
Jim.
Sophia,
Yeah.
and John and Amy touch upon a lot of the kind of like the vision and what I call like the bones and the structure of what we're trying to build as an organization. But to touch upon a part of your question that I think is critical, and that I employed in my day-to-day as much as I could when I was in the governor's office, is when you're talking about impacted communities, you have to go to the impacted communities, right? I one time had somebody when I was in the governor's office basically invite me to come see their provider organization, meet their staff and the people that they serve. And I think they kind of jokingly but pointedly said, come from your ivory tower up there in the Capitol and come visit us here in Brooklyn, right? And guess what? I mean, my chair was an old inherited chair that didn't even swivel. I was not on some throne in an ivory tower, but I took that to heart. And I think as the CEO of Inunity Alliance, I look at this role in many ways, but I'm very hands-on. Even as CEO, I'm going to, not only from a member support perspective, visit all of my members and also hopefully prospective members. But to me, the most important part of that is they are in their community serving people with these life-saving services, right? And that is the best part, I think, of any job, is when you actually can connect what are you doing from a policy and investment and strategic thinking perspective to where does the rubber meet the road? The people who either cannot get access to services and are not. If I could just quickly, Sophia, just give a shout out to one of the member organizations. And this was one of my trips. This wasn't the person who said this to me, but one of my most fondest memories from the governor's office that actually led to practical policy and investment decisions that we made was I visited the Institute for Community Living in Brooklyn. And Jody Rudin and her amazing team, they launched this this initiative that is amazing called Changing Spaces. They were recently profiled in the media. We just happened to visit this transitional kind of living residence for people who are unhoused and struggling with addiction or mental illness. We happened to meet their first resident that day while we were visiting. And it was to me, those are the life-changing moments, not only for that person, but for the staff and then for people in policymaking and government roles. And to me, that's the approach. That is the approach that we all have to take, whether it's a foundation, a local legislative office, the governor's office, or an advocacy organization. We cannot just prescribe solutions without actually getting, details on the problems and proposed solutions from the people who we're trying to help.
Yes, I'm really appreciative of that. The fact that there's sort of opportunities from folks in the community be part of this. And actually a question came in, just a point of clarification. Are state executive, legislative, and judicial branches represented formally in this alliance?
So we are primarily, right, a member-based organization where our members are addiction services, mental health, and social service organizations. But I know Amy and John, also have built membership based on other coalitions as well as corporate partners. But unless I'm mistaken, Amy, we don't formally have government partners.
No, but the thing that we do, I think, in proceeding with our policy recommendations and our regulatory recommendations, is to make it a priority that we have really good access and good relationships with those state agencies, so that when we're offering, constructive criticism, it's seen as constructive criticism, and that it will always come with recommended solutions to the things that we're criticizing, as well as, when there's an initiative being launched that's going to be helpful to communities, to be a voice in the community saying, yes, A, very good idea. B, we need more of it, and how can we support you so that we can get more of those services where they're needed. So while they're not members, they're definitely extraordinarily important stakeholders that we have to incorporate into our process.
Yes, and coalitions really provide a bridge often for members with government to facilitate communication and understanding on a wide range of issues.
Great.
And Sophie, I see in the chat box, Carol made a couple of really, really strong points. One having to do with this whole idea of data being transformed into actionable information. And one of the things in terms of just setting an expectation for folks who are joining us, this morning, and and this afternoon, that is something we've talked a lot about, and we realize that it's a huge deficiency for all of us when we go to important policy discussions and important program discussions, and we don't have at our disposal the kind of data. We just have anecdotal surveys from our members, so we have a really strong commitment there. And I think the other point, which is a really strong one, having to do with the mindset of where do we start? The grassroots, the importance, and Ji-Hoon just touched on it with his visits to community-based organizations. This is fundamentally about how do we touch people where there's a need to be touched. How do we be present in communities that our health where there are disparities in healthcare? How do we really, in a meaningful way, try to advance and transform the system? We are not even remotely interested in the status quo. We're interested in strengthening the things that work. We're interested in transforming the things that have not worked, or that worked in the past, but we're in a new place now, and we need to make some changes to it. And the only way that we can do that well is by having a strong membership, by having people who do a whole full array of services join with us and work with us and help us and help to empower us in that work. But it is absolutely a bottom up. It is, and it's not even bottom up. It is sort of embracing our diversity, embracing folks who have a very targeted interest as well as a very broad interest. And how do we bring in the enthusiasm, the knowledge, and the expertise so that when we produce a white paper in the policy center, or when we're doing work to integrate services, we have really the knowledgeable people in a community who know how that needs to be done in order to meet their needs.
John, have you guys partnered with Medicaid health plans in New York City? What role do health plans have as part of this work to facilitate mental health substance use services for those most in need?
Well, I'll let Ji-Hoon answer that, but it's a great question. We're all right now dealing with a major security breach or a cyber breach with billing and e-prescribing impacts on our field. And were it not for the fact that we had good relationships with some key people, we were able to kind of reach out to some of the health plans to find out what's going on, and what do we need? How do we inform our members about the best path forward? So I think key stakeholders are key stakeholders, and we're not going to agree on a lot of things sometimes, but we've got to understand how can we support the people that we're serving in our agencies, and how do we support our agencies? And we can't do that if we're burning bridges. We have to be building bridges.
Yeah, and there's a comment in the chat here about crisis stabilization must be able to connect people with co-occurring competent care as a point to also kind of insert here. I'm sorry, Ji-Hoon.
I was actually just going to add to what John said about the plans, but yes, I mean, the answer is that we have regular dialogue with the plans and have a very good relationship with them. They have been involved with the coalition and with ASAP prior to the merger, and we continue that partnership. I think it's critical that even where there are places where we disagree or hope that plans would do more, or sometimes, as I say colloquially, just like do better when it comes to our populations. Certainly having an open door and dialogue is instrumental. And as John referenced, the Change Healthcare cyber attack, they have been a great resource to me over the last week trying to help problem solve. So I certainly see the value of diverse coalitions. And can I just, and I know Michael Orth mentioned a bit of concern. 100%, I agree. I think that's a slip of the tongue, but yes, I think there are obviously very high rates of co-occurring disorders, and the science is clear, the data is clear, that one almost more often than not goes with the other. So we certainly share that perspective.
Yep.
And so the questions are coming in fast and furious, and I appreciate that. Thank you. We'll make sure to try to get to as many of them as possible. One question that we have also is in relation to sort of the fine balance and the dance that we often have to play, and how we invest limited resources when you're addressing the sort of the short term and most immediate needs of individuals and families, and how then we can think about sufficient and sustained resource investment to address the long-term solutions. So I'm curious to hear what your thoughts are on this, and what can be done either in the short term to meet individuals' needs, and or also sort of your thoughts about the long-term solutions.
But I think, the short-term solutions, which is, are obviously at the top of our list. I mean, right now, if you look at the governor's budget proposal, the one House bills that are put forward by the Senate and the Assembly, in the short term, we've got a workforce crisis. It's on us right now. We also have a real concern about unhoused persons, and the impact of people who have untreated, very frequently undiagnosed mental health and addiction issues. So those are issues which will be with us for a very long time, but the failure to create the supports necessary in communities across New York State and across the country, Amy's mentioned this is a national problem. The failure to provide the necessary supports it is a huge factor in what we're experiencing in communities and in the streets, in the neighborhoods, across rural, urban, and suburban communities across New York State. So those short-term crisis points are really the things that we have to pay attention to, because if we don't have the infrastructure in place, we don't have the resources to do the work, the communities are still going to, and the media will increasingly be looking at those people as the problem, and not our failure to provide the necessary supports as the problem.
And our goal is really to help strengthen the sector so that our agencies can provide these crucial services. We have so many agencies that struggle with increasing infrastructure costs, because when you run a not-for-profit now, you need technology and compliance and data analytics and health benefits. And how do we bolster the infrastructure and certainly the workforce so that we can do what we're supposed to be doing? And it is so crucial at this moment.
And Luis asked the question about the migrant communities and newly arrived people. And I think, Sophia, your question is extraordinarily important in dealing with the needs of migrant and newly arrived people. So food, clothing, and shelter is an immediate need, and compassionate care, a welcoming environment is crucial. And building the infrastructure, again, that in many cases does not exist. How do we make sure that we've got enough people who can speak the languages of the people who are coming, so that we can, sort of have good communication? Those are all like very, they're on the surface, they look like very simple things, but if we've got to, as a community of helping organizations, we've got to be a part of the answering those questions, not just part of the discussion, but part of the process of answering those discussions. We know how to feed, clothe, shelter, embrace, welcome, respect, honor people who are coming into our community. We know how to do it. If we don't have the infrastructure, we know how to advocate. But we absolutely, I think, have to figure out, how do we do this together? As it's the proverbial, it takes a village, and in this case it does. And I think, very proud of the work that so many of our mental health and addiction organizations that do have some capacity to house people stepped up and were welcoming. But it's clearly, you know, and the governor and the mayor and others across the state and the country, you know that this is a huge problem. But we have to be part of this. We have to be part of the solution. And frankly, we should be receiving the resources necessary to help in the way that we can, because we're not afraid to do this work.
Absolutely. Thank you. And so in the last few minutes that we have left, I wanted to tee up the last question really for you, Ji-hoon, in terms of what's in store for Unity coming up, particularly in regards to any advocacy work or otherwise that that you would like us to be aware of.
I mean, thank you for that. I think one of the first things is focusing in the immediate on, you know, what is happening in Albany with the budget negotiations, right? There were, I think John talked about it briefly, but there was some good and bad in both the governor and the Assembly and Senate's proposals. We are actively working with our other partners and peers in the stakeholder world to impress upon them the urgent need to ensure that providers that are providing life-saving work to individuals with addiction and mental health disorders, that there's an adequate and well-paid and well-trained workforce. I think that's key number one from an external kind of advocacy perspective of what's coming up in the immediate. But I think overall, I mean, there are two big priorities, which kind of sum up into one word: build. Right? We're in the stages of building this new organization that comes with you know, the resources of both the coalition and ASAP. But yes, one of the things I'm focused on is hiring someone to run our policy center. That is a position we just posted the other day. We're very excited, you know, to really get started with a policy center that distinguishes in Unity Alliance from what has been tried in the past. And then secondarily, I mean, that's internally, you know, in addition to building the organization, and you know, obviously there are many people joining. I think whether you're from government or nonprofit or the corporate world, if you are interested in finding out more about joining and partnering within Unity Alliance, either as a formal member or as a thinking partner, please do reach out. But we want to build these strategic partnerships, right, in a way where we are not like self-limiting ourselves, because I think it is typical. And I honestly was wondering in my interview for the CEO position, I was pretty critical about the advocacy that's happens on the state level. And, you know, I think from my perspective, part of the thinking was, well, you know, I do have some great ideas. Why don't I just go do it, right? Honestly, that's kind of why I'm here. But in reality, I think that includes strategic partnership. And I think Amy and John have done a wonderful job of building those relationships, and really look forward to kind of carrying the mantle and seeing it forward. You know, and again, they're the bones and the infrastructure of what we hope to accomplish with the Policy Center, the Equity and Leadership Institute, a business and training center. But ultimately, all of this points to why. Why are we doing any of this? And we're a member-based organization, yes, but at the end of the day, who are the members serving? Who are they reaching? And ultimately, we will not take our eyes off that kind of prize, because unless New Yorkers who are struggling with addiction and or mental illness have affordable, accessible care when they need it on demand, as we almost do on demand in the healthcare sector, the big H healthcare sector, none of us should rest easy, you know? So I think ultimately everything that we build, and yes, we're building right now. I don't want any illusions about the fact that a merger can be messy and it kind of brings to the surface a lot of things that might need to change or some things that will continue. But we are in the building stage, and we really welcome additional partners who want more information about how you can contribute to this effort. But I also look to build the staff of Unity Alliance so that we can really hit the ground running.
Absolutely. Thank you so much. And you know, I think this warrants a follow-up question, our webinar, I believe. You know, there is a point about the need to also have recovery as part of the dialogue here. And we unfortunately have run out of time. And so I want to echo a sentiment of a colleague of mine who sort of, really gave a shout out to the work that has been done to get to this place. This is an event that rarely happens in nonprofits, a merger on behalf of strengthening ability to accomplish your mission, merger of two, important organizations to help strengthen your missions together. And so I want to thank today's speakers, Amy Doran, Ji-Hoon Kim, John Coppola, and I also want to thank Maureen Kozine and Erica Van Boxtel from our communications team for helping us to put this together. And so I hope that we've been able to sort of, provoke some more thought, and we encourage everyone to continue to have these conversations about how we can all work together to make this vision a reality. Thank you all, our audience, for joining us today. I hope you have a good day. Take care.
Thank you.
Thank
Bye-bye.
you.
Thanks.